I want to start by saying thank you to my referring providers, not only for your compassionate referral of so many amazing families and patients, but for your ability to want to help me provide postoperative wound management for the releases of our tongue ties, lip ties, cheek ties. The patients really benefit from the multi-collaborative approach, and so thank you so much. You may even see the patients more often than I do postoperatively. I really push for and shoot for 1 week post-op at least, more if needed, especially if parents are having a hard time with providing the wound management. If you suspect a reattachment of any form, you'll notice when you're doing that wound management lift, you're doing the lift and you see restriction, you see that the diamond shape is actually raising up off the floor of the mouth, that you see maybe even an Eiffel Tower appearance where kind of behind or lingual to where the teeth are going to erupt for the small infants, or behind the teeth for the toddlers and young children. If you do see that kind of raised up, more of a larger bump, yes, there is a collagen bump that can appear. Usually though, that's not until 30 days to 90 days post-op. More likely you're gonna see a restriction, and it could be the release wasn't done accurately, or more likely it's just the parents are having a really hard time stretching the wound and keeping it from reattaching. If you do see that though, warn parents that there is to be expected some bleeding. Never that much bleeding. Even with the laser, there's almost no bleeding after release. But when there is a wound reattachment, when we're pulling and stretching that scab through that wound management, some bleeding can occur. And mixed with the spit, it always looks worse than it is. I've never had to put pressure on a wound. I always just have parents either start to nurse or bottle feed as soon as they can, or a pacifier use, or even my own finger just to calm the patient so I can talk to parents. But I always ask for permission first. I recommend that if you do suspect that there's a reattachment. And then just encourage parents to know that they may want to feed right away afterwards, especially if bleeding's noticeable. Sometimes pain can get in the way, so having access to Tylenol to offer that to the parents, or if they have Arnica Montana on them or in the diaper bag, that's a good alternative as well too. It does take some time to dissolve in breast milk, so it isn't always something that you can easily access in the office, but they could do that, make that up at home. I just want to thank you for being, intuitive enough to know that wound management is critical to our success, to prevent reattachment, and that you're willing to do some wound management. Kudos to you. If you're not used to seeing bleeding in mouths, though, just know that you can never overstretch the wound more than what the laser opened it to. So you can't slip, you can't pull too far, you can't cause any kind of nerve or muscle damage doing a wound management stretch. It's just impossible. So thank you for being brave enough to do that, and I know the parents will thank you as well. Take care, and thanks again for all the beautiful referrals.